My name is Alina Valdes with an S. Everybody gets that wrong. And the reason I was asked to speak today is because I've been a medical doctor, a general internist, for over 30 years. In that whole time that I have been doing this, I have always worked with the poor, the uninsured, the people that have very few resources to pay for their medical care. And I've enjoyed doing it. I do not regret it. I've actually loved it. Once I started doing it, it almost gave me a passion, a mission to my life. And once I found out that Affordable Care Act was going to be a law, it made me very happy, because I have always found it very difficult. Like I said, I take care of people, but they don't come to see me until they're at their last end. Their hypertension is so uncontrolled, they have a problem that has to be corrected yesterday. That's when they come to see me, because they don't have the money. They have to choose my kid's shoes or my copay to see the doctor, my medication or my kid's school books. That shouldn't be a choice that any of us should have to make. We all pay for uninsured people to get health insurance, whether you know that or not. And I need to make that clear to everyone here, because I think most people do not know that. I am speaking as a doctor, but I am also aware of the issues that are coming up with people not getting health care. I want everyone to know that has health care that you are all paying for the uninsured people to visit hospitals for dyke medicine. Put the finger in the dyke medicine that is not going to do anything, because I see these people every day. They come to see me in the homeless shelter with medications that they were given in the emergency room that they could not fill because they do not have the money to get the medicine. So what good was the ER visit? They come in to see me because they went to the emergency room for medication refills, and they could not get the refills, so we just paid for the ER visit, and they still don't get their medicine. So I give them the medicine, because fortunately we have benefactors, people who donate their services and their time and their money to help us. Plus, thank God, I have to give a shout out for Publix, because they do give some free medications to people. And let me tell you, I use them a lot, and I am glad that I do. Just to finish off, I'm going to give you one example of a story of a patient, and none of you here that have insurance would put up with this. A man who has a hernia, an inguinal hernia, 4 years already. He was told that it would cost him $1,200. He didn't have the money. All right, so he waited. Well, what do hernias do? They grow, and they get bigger, and they become a problem. So now he's in the shelter, and his hernia is incarcerating. What does that mean? It means that it is locking up into the inguinal canal, into the place down there, and it's staying out. If it stays out, it gets strangled. And if it gets strangled, the intestine dies, because that's what gets strangled. So he went to the hospital, to the ER, twice in 1 week, because that happened to him 2 times. The first time they pushed it back in, and let me tell you, that is very painful. The second time they couldn't push it back in, so they put ice on it. How would you like to have ice put on your groin? How would you like to have that done to you? Okay, but he sat through it. They were able to push it in. So he asked, so when can I get this operated? Oh, but you don't have insurance. You have to have insurance. Or wait until it incarcerates. It becomes necrotic, which means that the bowel dies. Now he gets septic. Now they have to open him up all the way, take out that dead bowel, put in a colostomy bag, how many days or weeks of hospitalization, and he may be disabled. So now we have a viable patient who was working because this man has a job, who now can't work because he had this problem, and who will most probably now be eligible for Medicaid, regular Medicaid. Is this what we really want to continue doing? I challenge Representative Oliva and anyone like him who does not believe in Medicaid expansion for our neighbors to come with me for 1 hour when I see people in my practice in the homeless shelter and see what the human cost is, because you cannot deny that. I speak to these people every day, and they always affect my heart. It can't help but affect me, and it would affect them as well, because if it doesn't, they don't need to be where they are. They don't need to be representing us. Amen. I thank you very much, and let's get this thing done.